but whenever I see that building, even though it's no longer called Standard Oil, I think of Ambetter and Centene and my friend Shondell. So I just love downtown Chicago. I'm a big fan. So
Yeah, yeah.
yeah. So kidding aside, if you have a question, you'll put it in the question box. We're going to monitor these throughout the presentation, not just at the end. You know the drill. Put them in there. I'll jump in and we'll have some commentary right away. So here we are, the individual department, myself and Carla Winfrey. Carla is our individual specialist extraordinaire. She does everything and anything associated with back office issues, billing. There's some claims information, claims needs. It could be, a carrier-related item. Give her a shout. More importantly, email her, and she'll get right into that. And she also helps out tremendously on the delinquency reports that are so important this time of year. So Carla Winfrey, a big shout out to her. And of course, there's my information. By all means, if you are not appointed with Ambetter, get in touch with me so we can get the ball rolling on that. And I hope at this point in time, everybody's done their certification. If not, and you're having trouble with it, with the FFM, let me know. And by the same token, if you have any issues with Health Sherpa or for that matter, anything related to enrollment, give me a call. And with that, I'm going to toss things to Shondell, and I'm going to stop my sharing and go ahead, Shondell, throw up your deck.
All right, perfect. And hey, Joe, I'm not sure if I can, but or maybe at the end I could put my contact, information in the chat or something, in case
Absolutely.
somebody got questions. But
Absolutely.
go ahead and show my screen. Give me 1 second here. Right. How am I looking, Jeff?
You're looking great.
All right. Love to hear it. Okay. Oh, I'm all good. I can go ahead and proceed. And
you can go ahead.
All right, right on. Okay. All right. I know it's the afternoon. Hello again, everyone. I am Shondell Coleman, account executive for our Midwest region. I've been with Ambetter, went on 8 years since last month. So I had my little anniversary there. But hey, what I wanted to do, I thank Jeff and the team for giving me the opportunity to present to you all. It's been a lot of changes we've been hearing across the news, and me and Jeff were just talking about that. So a lot of questions too, right? Like what other carriers doing, what members want to be in position, and all this other stuff. So I'm just here to educate you all and just give you a bit of information on what Ambetter is looking like going into 2026. Some states I am just focusing on right now is just a couple of states. It's a lot of information, so I am going to pinpoint Ohio, Indiana, and Kentucky. If you got any other questions around other states, feel free to definitely reach out to me, and we can talk more about that. So I'll go ahead and move forward here. All right. Let's see if I can get rid of this here. All right, perfect. Okay, so a lot of you all, some are new, some of you all are been with Ambetter, so you pretty much know about Ambetter, right? So we've been in the business since the beginning, right? Since ACA. I would say us as a carrier, even when I first started, right, I just seen how much memory and growth that we built over the years, and it's all because of you. So kudos to you all for all your hard work out there. One of the things I want to pinpoint is that 5.6 million members we've gained and labs that we supported. So again, thanks to you all. We are now in 29 states. Continuing to try to expand, either that's counties or even states in the future, right? But yeah, you're with the best carrier. I think Ambetter speaks for itself. Our stability, our financial, and just how we plan ahead 5 years to 10 years out. So I think we're in a good place and moving forward. Okay, so a lot of information, right? So as of August 2025, the monthly low income special enrollment period has ended, right? So that means folks earning 150% or less of the FPL are no longer be available to switch plans or, issuers on a monthly basis. This applies across all exchanges. So what does that mean for you? Clients who have taken advantage of that flexibility would now need to enroll during open enrollment. So don't wait until after open enrollment is over to reach out. These members will need your help before open enrollment ends. Now, if someone experiences a different qualifying life event, they may still be eligible for a special enrollment period and for the remainder of 2025 and 2026. But just to be clear, having a low income alone won't qualify anymore. So, make sure this change is on your radar so your clients don't fall through the cracks. One important exception to this provision, it does not apply to federally recognized tribal members. Okay, the enhanced advanced tax credit, we all know, right? It's set to expire on December 31st, which means they won't be available for 26 health plans. If you've been working with these credits, they help a lot of households lower the cost of their monthly premiums, especially those households earning over 400% of the FPL. With these enhanced credits going away, many members who relied on them will see a noticeable jump in their monthly premium. So that means there is a good chance that some members choose to go without coverage. The Congressional Budget Office, they estimates that this change alone could result in, I think, 4.2 million more people going without health insurance over the next decade. It's vitally important that your clients understand the importance of remaining covered. Now, just to clarify, the traditional advanced premium tax credit for households earning between 100 and 400% of the FPL are not going anywhere. This change only affects the enhanced version of those credits. So this shift could mean a lot more work, for you during open enrollment. Your clients will need help just understanding, what's changing and why staying covered is still so important. And that is something you probably emphasize already when talking to your clients, but it's going to be more important than ever. I got to say that. So start planning now. Many of your clients are going to need help finding affordable plans that still meet their needs. Okay. So, pay attention to these key dates for this upcoming enrollment period. If any of these deadlines are missed, it can mean a lack of vital coverage, for our members or your members too at that. So just FYI. All right, member communication. So prior to OE, current members will receive renewal letters. Letters are specific to the member's plan and the state. For discontinued plans, the renewal letter will include the best similar plan for the member to auto renew. We will send renewal letters for discontinued plans to impacted members by the end of September, which already passed. For all others, renewal letters will be sent by the end of October. Renewal letters will, encourage action by December 15th, just to ensure an effective date of January 1st and no lapse in coverage.
Shondell,
All right,
hey, Shondell, I want to jump in here real quick. When do you think those renewal letters will be going out?
So those renewal letters should have went out already end of September. So some of your members should have already, got those renewal letters already. And then again, anything that's discontinued, and I'm talking about any state, out there. Though those renewal letters are with it, they're sent by the end of September. So your members should have received that information. Feel free to follow with me too if you got questions. But those should have went out already.
Is there a premium listed on those renewal letters?
You know what? Good question. I'm really not sure. As we going into the, with these changes and stuff, and what that renewal letter actually looked like. And I don't think that it give you that information. This is just a sample, here on that renewal letter. But I don't think that we put that information though. And plus according to the sample too that we have here, what that looks like. So, but yeah, I think they kept that out.
Okay. Thank you.
Yeah. Yeah, anytime. Stop me anytime. Binder communication. So, these reminders to, new members to pay their binder payment and ensure coverage will be effect by January 1st or the deadline for effectuation, which is February 1st. Ambetter Health, we coordinated communication plan to frequently remind members via text, email, automatic calls, that the binder payment is due. So the urgency of the messages increases with time to encourage action until receipt of the binder payment or the deadline for payment is reached. So, dearly noted. Okay. Member information packets. These are distributed to new and renewal members whose binder or premium has been paid. They are sent out within approximately 7 days of the receipt of payment. Okay. Some of the key information here, included in a member information package includes, as well as there, you'll see a sample document of what that renewal letter looks like for you. Okay.
Before we
So,
go there, can I
yep.
jump in with a question?
Yeah, absolutely. Absolutely.
Will we be able to see those renewals for each member in our broker portal?
Yeah, just like last year, when we rolled out, the renewal letters, yes, you should be able to see those in your portal, as well. As far as a date for that, I think is as we get close to open enrollment that you'll see that.
Okay.
Yeah.
And personally, I am thinking the rates will be available that last week of October. That's just me saying that. They're
Mm-hmm.
not out there today, but if memory serves me, it's generally the last week of
Yeah.
October.
Mm-hmm. Yep. So we will see as we get closer and what that looks like across the markets and especially in the markets that you all sell in. I know a lot do Ohio and Indiana, for sure. So
One more question. Where in the portal are those viewable?
the renewal letters when they
Hmm.
come,
Hmm.
when you go log into your portal, you should be able to see the renewal letters. I believe if it's under the, let me see, double check. I think it's the either resources tab. Don't correct me if I'm wrong, but in your portal, I think it's either if you click on the policy or it's in your resources tab. But let me confirm for sure. I know it's in your portal,
Okay.
but I can make sure I get confirmation on where exactly you will see that. I'm just not sure if it's actually, when you click the policy of a member or if it's in like the resources tab where we have like, different
Okay.
forms and stuff and information for you.
One of our amazing agents, and they're all amazing. One of them comments, I can see the renewal letters and they do have an estimated amount.
I do.
So,
Okay. All right. All right.
so, and
Estimated amount too. So
estimated, that's the key because you wonder,
yeah.
with the refiling, most of the carriers did some refilings in September. I think Ambetter may have been one of them. So I would caution uh, as to if that's the proper amount.
Mhm. Yeah. Yeah. It's always estimate just to, it's not really like, hey, this is what you'll be paying or exactly, because we don't know still. It's like we got to really wait till the rates even come closer but we'll send another one too afterwards. This is just to get something out there to the member, have them thinking and if they want to make any changes and such.
And not to belabor this too much, we had another um, response. So for the renewals, you click on members in that portal, members, select the member, and then scroll down to the bottom, and then there's a renewal button.
There you go.
Okay,
Nice. Thank you. Thank
fantastic.
you. I knew it was like you had to click on a policy or either that, but yeah, thanks for clearing that up to
Okay,
confirm. Yeah.
okay. I think we're all caught up.
All right. All right. Okay. So all of our Ambetter Health members, okay, they have access to virtual services through Teladoc Health. This does include 24/7 to medical professions, either via phone or video for non-emergency medical issues. So it's an easy way to get fast, care for those members in those outlying or rural areas. We all hate those long wait times too, especially in person. So we still have that available, and it's very very popular. So it is free virtual access for members to definitely take advantage of that. I know I used it myself, and yeah, it's definitely very convenient. Okay. Okay, so we're going to start with Ohio. Okay, let's see what's going on in Ohio. So some updates here. Quite consistent, right? Not really big. I will say the Finder provider compared to in the past, they have done some enhancing designing that just to make it more, user friendly, right? I will say about the Ambetter Health app. We could talk about that more later. We got our Ambetter Health Solutions off exchange plans going to be available 2026. Okay, that's not going anywhere. We got our My Health Page rewards. So, we could definitely talk about free money and how members can earn and better perks. So, little different things members can take advantage of, discounts around different things that we do on a daily basis. And then, as I mentioned before this slide, the virtual 24/7 care for members. All right, so network highlights. Now, this is a partial list. Okay, this is not a full list. So we just want to put some from different areas, just to pinpoint for you all that we have a network going to 2026. You can definitely go on to find a provider. The link is findaprovider.ambetterhealth.com. Again, that's findaprovider.ambetterhealth.com. That take you to our Find a Provider site. And feel free to check out any in network. So, our network going to 2026 is pretty, consistent. There has been any major changes I've heard as far as with health system, anything like that. But just want to point out that some of the highlights here for you all going to, the next year.
Nice, very robust in Cincinnati and Cleveland.
Yeah. Yeah, I hope that's a good thing moving
Oh
forward.
yeah,
Right?
that's great. Columbus looks great. Yeah,
Yeah, yeah.
Ohio State. Guys, if you need to comment right now, good time to do so.
Yeah, for sure. Okay, go ahead and forward here. Okay, so the Ambetter Premier Portfolio, okay, it is our broadest provider network. It is available in all Ambetter Health counties. So with the Premier Portfolio plan, a member can visit any in-network provider with no referrals needed. In addition to that, members of the Premier Portfolio plan can buy up, if they want adult vision and dental plans, and they can earn My Health Pay rewards, but just by doing various activities. And I think the key word here too is reciprocity, right? So a member would just love like, hey, I don't have to just be set in stone in Ohio. I can go to Indiana, Kentucky. I can go to Florida, Georgia. It's as long as that provider is in network. I think that's a great selling point, and to let members know that hey, you can travel just as long as that provider is in network.
Okay, can I jump in?
Yeah, absolutely.
Okay, Jill's got a question about Dayton Children's. Do you know if it's still contracted?
Dayton Children's.
Yes.
Um, You know what? I don't know off the top of my head. I think we do have them in network going to 2026. But feel free to, and I'll put my information in the chat too. To follow up with me on any questions I can't answer to you right now. I just can't tell you off the top of my head right now. But whatever we had in 2025, there hasn't been any major changes. A network leaving provider, anything like that. So, again, we're going into 2026 pretty consistent with the providers we have this year. But yeah, I can definitely follow up on that. Just be sure to, reach out to me just so I can make sure that question gets answered for you. But I'm pretty sure we got them going to 2026.
Boy, I can't stress enough. I can't stress enough how wonderful the Premier network is. You're the only carrier that we have in Ohio that lets you cross over to state lines and utilize the Ambetter network over there.
Yeah, look at that.
For non-emergency, and that's massive. I mean, you're not an HMO. You're actually, aren't you like an EPO, the exclusive provider
Yeah,
organization?
yeah,
A different,
yeah. And you know, even if it's HMO, EPO, it's like that Premier, it does such some good, you know, especially for members, you know, snowbirds and stuff out there, you know. So we definitely understand the value. That hey, you got a plan, but it comes with so much value behind it, you know, traveling,
right,
your
right,
medical needs, all that stuff. So it's good to hear that too,
right.
Jeff, that we're on the carrier
Yeah.
that's doing that, you know, out
As
there
for,
that's doing
well,
that.
as of the ones that I use, I mean, that's here in Ohio, that is. I have to
Mhm, mhm.
qualify my statement there, but I mean, that you guys are the go-to in that realm, for out of
Yeah,
state stuff.
yeah,
So,
yeah,
and to that end, I think you're going to talk about solutions.
yeah, yeah, absolutely. I think that's in the next slide here. Actually, I'm glad you brought that up. Well, not just yet. So,
Okay.
counties, where are we looking like 2026? So, this is where you know, our premier and solutions plans, both available in these covered counties. Okay, so not much changes, right? I mean, it's like I said, Ohio is quite consistent and not any big changes at all. So it's good to see that, you know, just going to 2026, you know, we're still staying on top, you know, compared to other carriers and the changes that you're hearing and seeing. So I think it's actually this next one here. Okay, so our premier portfolio. So we have our three you know, different tiers. So we do have the bronze, the silver, and the gold for the Ohio HMO portfolio. And that's premier. So, you know, the vision and dental add-ons is optional for those members if they want to take advantage of that.
Can you make mention about bronze, what the BBB, the Big Beautiful Bill, did for bronze plans?
Oh, I mean, I think you'll see that in the next couple
Yeah.
slides here. Yeah, yeah, I'm definitely getting to that, Jeff.
Okay.
Yeah, it's coming.
Okay.
But yeah, this is just premiere though. You know, we're you know, speaking on first right now. But yeah, more comes. I can let you all know. In Ohio though, we're speaking on. This is just Ohio, so you know our plans is pretty pretty, you know, they, how can I say it? No changes. I mean, really, right? I mean, on
Mm-hmm.
Ohio, I
Mm-hmm.
mean, it's pretty the same. It's good to know, right? Because you probably have some members out there that like the plan that they have, and you know, we don't really
Oh,
want to make any changes to that. So
oh, definitely.
yeah,
Definitely.
just for Ohio, you know, we're you know, looking pretty good. So, but yeah, more as I go down to the presentation, other states we covered. But yeah, we started with Ohio. We're pretty good there. Let's see here. So rolling over, you know, we have the everyday bronze. So I'm not gonna go through, you know, each and every one like that, but one of the plans that we have here, you know, have the copay specialists and labs. This plan was going anywhere to everyday bronze. So if you got any members on that, you know, we'll still have that going to 2026. Now the standard silver, so this one specifically goes as low as $0 deductible under the 94% AV level. So it does have a much more, you know, lower max out of pocket and the co-pays, you know, as well on the standard silver. Okay, there we go. Ambetter Health Solutions. So, you know, some of y'all may be new too, right? So this is our new off exchange plan for 26. You know, these plans are designed for our off exchange members that are purchasing health insurance through an ICRA. So just to reiterate too, you don't have to just do ICRA, right? I mean, anyone can actually get on the Ambetter Health Solutions. But you know, it was tailored down to, you know, because we're seeing ICRA, you know, continuing to grow, that we made a spot for that for, you know, brokers like you or some that are dealing with employer groups and things like that, to give members the assistance they need. But the health solutions plan are currently offered in Georgia, Ohio, Indiana, Missouri, Mississippi, and South Carolina. Now in 2026, expanding into Arizona, Florida, Kansas, Nebraska, Tennessee, and Texas. So we're doing a bit of expansion there. So, our Health Solutions plan, they offer members in-person care, with our broadest network offering of healthcare providers and hospitals available. Members have reciprocity. I always like to say reciprocity in all Ambetter Health service areas, except California and New York. Okay. So these are qualified plans that offer the same essential health benefits of our gold, silver, and bronze plans. There are even new platinum plans available. Okay, they're going to be in Georgia, Indiana, and Ohio. The Ambetter Health Off Exchange that were previously offered have been the member can enroll through EDE Power Health Sherpa. I know a lot of brokers use Health Sherpa, or you can go through Ambetter, which is the enroll.ambetterhealth.com. Or again, you can go through your ICHRA administrator. So, you definitely have options to put that member on an Ambetter Health Solutions plan. And, as we've seen a lot of changes, right? And some of us think about our book of business. Maybe something you could think about, the member could think about too. If they're on an order exchange, maybe can see if they can get on an off exchange or Ambetter Health Solutions, if it fits right with them. But just something to think about. I think the Ambetter Health Solutions is a good one. And we just expand to more states. So if you sell in multiple states, that'd be good for you. All right, so there's the 2026 Ambetter Health Solutions portfolio. Okay, it offers 3 tiers. I would just say the bronze, silver, and gold. We will have the platinum plans, but only for the solutions off exchange portfolio. So it won't be a factor for the vast majority of you brokers, I imagine. But just want to point out, out there that, these the plans will be rolling out going to 2026. Okay.
And can I jump in here with
Yeah,
some questions? You kind of get caught up on this last segment. I think you answered this one. Is there reciprocity available? In other words, the crossing state lines. Is there reciprocity available with off exchange members?
Yes, absolutely.
Yep.
Absolutely. Think of it on exchange, right? Members that's on the off exchange, they get the same essential benefits as if they're on exchange. So, crossing state lines, having no referrals needed, it applies the same. And I think that's one of the great bullets too is even if you're on off exchange, you get the same benefit. You can see any provider across the state lines as long as they're in network. So yeah, answer your question.
It's really the one key element that makes these ICHRAs work. I'm in Cincinnati. Businesses in Cincinnati pull employees in from 3 states, and it doesn't matter how big or small that company is. You generally have 1 or 2 people from Kentucky. You've got a few from Indiana. So the ICHRA solution is definitely Ambetter.
Mm-hmm.
And another question, are there any network differences for the Premier and Solution plans?
Good question. Good question. There is no difference. I will say, when we start rolling this out, right, and it varied by state. We had to clean up some things out there. With some of the providers that we got contracted. We do have our own ICHRA team. So we worked well and hard, or that team has, to ensure that the members get the best benefits, the same as on exchange. So yeah, there's no difference. There's no difference at all. Again, you can see any provider if you're on an off exchange the same way as if you're on an on exchange, and you can see all this on the Find a Provider tool, right? When you're looking up, providers and things of that, it's all the same, all the same.
Okay, a few more questions. Sorry. Were the plans shown? Were the plans that were shown additions to the solutions portfolio, or only the solutions plans available?
So we do have some new. Yeah, let me go back here. Yeah, so yep, this the solutions portfolio. Like I said, they are introducing like the platinum, out there, um, plans and stuff. So some of these plans are the same, rolling over to 2026, but mostly like the platinum is what they, will be something new that they'll be introducing out there.
But this is what the solutions portfolio is. It's not
Yeah,
in addition to the Premier, correct?
exactly. Yeah, this is just
Okay.
the solution. So, I know you're recording or take a snapshot, but yeah, this is just the solutions plans out there.
Okay. Can you go back to the screen that shows other states on the
Uh,
solutions beyond Ohio?
let's see. Are you talking about this I'm in the wrong spot?
Okay, I think that's it. Yeah.
Just so
Offering
you know
six
like what
states:
solutions are
Georgia,
being offered.
Ohio,
Hmm.
Indiana, Missouri, Mississippi, South Carolina, and in 26, and that's what we're focused on, it's going to be added in Arizona, Florida, Kansas, Nebraska, Oklahoma, Tennessee, and Texas. Massive. Some of those states are adding a little kicker too. They're looking at adding something. I think Florida is. Maybe like a tax benefit to the employer, but you'll have to dive into that a little bit to see where those are. I'm going to add one more thing before we move on. Can you talk a little bit about bronze plans and maybe how they can be HSA compatible?
You know what? Well, talking about Ohio,
Yeah.
we do got that bronze HSA. Um, yeah, so well on the solutions, that there is the solutions bronze HSA on the bronze that we have. And then there's also even on the silver, there's the solution silver copay
Hmm.
HSA
Yeah.
that's out there too,
Yeah.
that you'll see going to
The reason I
2026.
Well, the reason I bring it up, and I was on a call with NABIP the other day, uh,
Mhm.
all of the bronze plans are supposed to be HSA eligible as a result of the big beautiful bill that was passed in August at the federal
Mhm.
level. So, um, I mean that I'm sure that will appear in on the enrollment at that
Yeah.
point. But that was kind of a late addition. But I'm told that all bronze plans would be HSA eligible. So that would be really neat. But
Yeah, yeah, yeah.
yeah.
You definitely got options on the bronze
Okay.
and the silver going to 2026. I know some members, like that HSA, having it. I had one myself, so it's always a good benefit to have.
And just one more before we go. Are there marketing materials available for us to explain to our Snowbird members how to leverage the reciprocity?
So, and one of the things, marketing materials we have and stuff like that, we do put that in your broker portal. I don't think there's anything out there in writing, I will say that speaks on reciprocity, as of today. So it's more, having the brokers like yourself, letting members know that, it's reciprocity, they can cross state lines, but nothing like a one pager, we have, I'll say, that just speaks on, crossing state lines or reciprocity of that. That has been brought up though, I definitely feel that's something we need to push a bit more. Let's let members out there know. Even something to give you all like a form or some or whatever, just to really give that member the peace of mind just by looking at something, rather than you just say, hey, you can cross state lines. But, as much as members can trust their broker, I'm pretty sure that they will. But yeah, nothing right now set in stone, I will say. I know as we get close to open enrollment, they will have copies of these, in your broker portal, and there are some forms in your portal too. But no, it's something we're hoping to really continue pushing though, and especially having something in writing. I know the site been updated a little bit. I know they got like the formulary and all that stuff. I'm not sure though if they input in anything around reciprocity or anything. I'm not really sure on our website, but yeah, I'll definitely look into that. I just know as of
Okay.
today, there's nothing we have
Okay.
on that. Yeah.
Okay. we've got a few more that came in, but let's just get started, and we'll get to those towards the end of the presentation or our next
Yeah.
break. Okay.
Yeah,
So
sounds good. So we Indiana. We are at Indiana. So what updates? What's going on in Indiana? So we are going to be statewide, right? In Indiana. We still got our health and better health solutions office change plans. I'm not going to go through everything. This is from the other slide too, but as far as the main updates is being statewide and then have the and better health solutions office change plans there. All right, so just like the Ohio, this is just some highlights, some networks in certain areas that we want to put out there. I know we had a meeting this week or yesterday with our AOP team, and those the actuary team that and I asked them about the network, right? So with these changes, how does that affect our network system and things like that? Has there been any major changes? And as of today, there hasn't, So, even for Indiana, there hasn't been any major change or anything like that with the network. So, we're looking pretty consistent there also, going to 2026. So, but this is some just point things are just to point out, you can still go on a find a provider.ambetterhealth.com, to always look up in-network providers. Okay. Okay, I'm gonna go to here. Okay, again, statewide, Premier Solutions plans in all markets. Love to hear it. Okay, all right. So our Premier portfolio for Indiana. So it does the availability will vary by county, but no bronze plans available for 2026. So there will only be silver and the gold tiers. And of course, the vision and dental are add-ons, if the member wants. But just an important thing here, there will be no bronze plans. Okay, so real quick, one of the plans we have the Focus Silver, this is the $0 deductible. If a member is under the 87% and 94% AV levels. I just want to point this Focus Silver, just some plans that we saw some growth in, members getting on. Focus Silver is still there going to 2026. Now we're transitioning on to the solutions. So here, just like Ohio, right? We got the three tiers, the bronze, the silver, and the gold. You see under the bronze, there is the HSA PPO plan. And then there's the platinum, plan that they're introducing, the pretty much new going to 2026. So just like Premier, this is the solutions. So this is just a snapshot of, the plans that are going to be available. Go there. All right. So there is the PPO, right? So we got the Indiana PPO portfolio for solutions that I was just on. And then there's the 2026 EPO portfolio for solutions. So you'll see the change in the plans, So again, this is from there, and then this is the EPO. So you'll see there's still the HSA for both the bronze and the silver here under those tiers, and then also introducing the platinum going to 2026. So quite some options. Okay, so here is Kentucky. Just want to speak a little bit on Kentucky. Some new updates here because I know some of you all say out Kentucky members crossing state lines. We are doing the enhanced asthma COPD Care Silver. So this does have the $0 drug options, which is a new plan in Kentucky for 2026. We're expanding into Christian County as well. So that's a new thing, a new update for Kentucky. Everything else is pretty same from other slides, so I'm not going to go through that, but just to notate there's a new plan and then the expansion into Christian County. So network highlights. So new, we have Janine Stewart That's a new provider that we're contracting. So everything else is pretty the same. So this is just a partial list of some providers we have in network, but definitely wanted to notate Janine Stewart being a new one going to 2026. Right. All right. So again, Christian County. All right. See, always consistent, right? We try to be consistent in the states, counties year by year. And we are expanding to another county, Christian County in Kentucky. So here's the premier portfolio for Kentucky, the HMO portfolio for premier. So there's the three tiers. We got the bronze, silver, and the gold. So for that bronze, there's the Choice Bronze HSA. And then there's the new plan for the enhanced asthma Care Silver plan. Okay. One of the plans we already have is the Everyday Bronze. So again, some of these plans are selected because we just seeing some, growth in members getting on these plans. So the Everyday Bronze, excuse me, for Kentucky going into 2026 is going to be there. Got our Focus Silver going into 2026. So again, for those members that fall into the 87, 94% AV levels, does have that $0 deductible. Now here's the new plan. So there's a new plan. So again, members with this, if you're enrolled in this enhanced asthma plan, you have benefits to help manage asthma or COPD, so you can get the care you need without any, added costs. So, it does include, you know, uh, some of this, the $0 copays for some preferred medications, including like the rescue inhalers. We got the $0 copays for, select mental health medications. There's also zero copays for, allergy testing, and rehabilitation therapy. And we got care management. So we got care management, to guide, members' care and support their health goals as well. So when you check the plans formulary, or members log into that member portal, they can see what medications or services are covered. Okay, I will say that medications or supplies, if you see it that's marked with a letter C symbol, those are available at the $0 copay. So just FYI, but yeah, definitely this is a new plan for 2026. All right, so our adult vision add-ons, it's available for our designated plans. It is for members age 19 and above. The member may have their choice of glasses or contacts, but not both. The coverage does apply to in-network providers only. There's no coverage for out of network, but it is important to note that there is no waiting period. Here on the screen, you can see a breakdown of what is covered and any copay is required. Okay. All right, the dental. So it's an add-on. It's same as members 19 years age or above. It does have a maximum benefit of $1,000 per calendar year. The dental out-of-pocket maximum does not apply towards any other maximums. Again, only in network. And again, no waiting period. We all don't want no waiting period. So, but yeah, pretty same. Year to year. That we have our vision and dental add on. So that's good to note as well. All right. Okay, wellness and rewards. All right. So, if I can tell you that, as we see all these changes and possibly see a jump in premiums, if I can tell you, hey, a member can earn free money, they can earn actually up to $500. They can actually use, points that convert to dollars to, buy any things from our online store, or, we all got bills too, so we can use to pay those bills. And, that's where My Health Pays comes along. I always like to talk about this, but it is our industry leading rewards program. We use to promote wellness to our members' overall health. Members can earn points just by participating in fun and easy activities. I myself took advantage of this, when I came on board, and I love free money. We all like free money, but just getting the discounts, doing little activities, we do this so members can just, eat right, moving a lot more, being well, and just saving smart at the same time. And I think as of September, yeah, last month we saw 1.3 million downloads. 1.3 million downloads. So I always encourage brokers to, let members know about this so they can take advantage of it, right? So My Health Pay rewards points are earned by completing some clinical activities, like the annual physical, as well as online activities. They can engage with the My Health Pay Power Up rewards to accrue those points. So, your clients can earn up to $75 today, just by completing the first My Health Pays activities. And in little as like 15 minutes. So for example, points are earned by completing Pacific health screenings like the annual health wellness visits, the preventative screenings such as breast cancer, cancer screenings for women, and then men can earn points for, cholesterol or anything like that with screenings, and all adults can earn points for completing the blood pressure screening. So, a lot of opportunity out there, get that free money, and I always like to talk about it. So members they have two options to redeem those points accrued. They can use the points they earn from activities to purchase directly from our online reward store with the My Health Pay catalog. Members can also convert points earned into dollars to pay premiums, other related health costs, and even select their monthly bills. Again, we all have bills, so why not take advantage of My Health Pays to use that, right? So, and to transfer to the funds to money to pay premium and bills, members must be using the Visa My Health Pay prepaid card to get this nice little card like that. Okay, I will say that members who do not have a My Health Pays card, they cannot just go online to request a My Health Pay card until they completed activities. So once those activities have been completed, the member may request a My Health Pays card, and it'll be sent and mailed to their address. So they're not sent out automatically. Okay. Once the funds are added to the Visa My Health Pay prepaid card, it can then be used to pay for other expenses. Okay. So this is something to share. So, let's look at some year-to-date statistics regarding My Health Pay rewards program. So I can remember how low this number was, and it's like, wow, 850,000 health members activated My Health Pays accounts, and it continues to grow. Collectively earned over $52 million in rewards. Well, that was, I apologize. It's 80 million at that increase from the screen. And those who take advantage, like myself, we're likely to renew it because it does it every year. So why not? So it's a great program, that benefit members. So I will encourage, all your members, to apply and take advantage of this. So some perks out there, and some members may miss this, but we have some great perks programs beyond health and wellness. Through these perks, you also have, members only deals on the goods and services you use every day. Whether your car needs some maintenance, your dog needs some grooming, or you're planning a family vacation. Ambetter perks have you covered. Here are just a few of those ways you can save. So even from home, travel, entertainment, movie tickets, education, office. I mean, it's a lot, so much, a lot of perks out there, So, despite the change that we are seeing, Members can take advantage of these My Health pays and even these perks at the same time. So how they can register, members can go directly to ambetter.benefithub.com and they can register there and unlock all those savings, right? So the Ambetter Stay Healthy Zone, it's a community of Ambetter members that facilitates connection and support on various topics, including life changes or mental health, mental well-being, I'll say, stress tactics, nutrition, and much more, a lot more. So just want to point that out there just for a benefit for, members out there aside from the perks, right? So find a provider. So, we done some update, from the past. Find a provider. There you go with the link. Go to findaprovider.ambetterhealth.com. Okay. So from the home screen, you can simply go to, need to search for a provider from there. Okay. So either, you mess around a little bit, but you put the city, county, or zip in there. Make sure you select the right enrollment. Okay. And then make sure you select the right plan selection. So either that's a premier, value. Now, when you get into value, that's more of like the other states, like Georgia, for example. But in this case, it's premier and then there's solutions. So you make sure you click that. And then, you do have a search option. So you can do it by category, if you want. Or you can, put in certain words. You can see the specialty or groups or so. And then let's say you go ahead and look for that. You pull up some providers, that comes up, see the radius, how far they is. And then you simply just got to click on them, give you as much information more about the providers, accept any new patients or hours of operation, their NPI, is always important, to have, Then the formulary pharmacy. So I think the 2026 is out now. So just for your reference, just make sure, select the state first. If you go to ambetterhealth.com, you'll go to the for members tab and hit drug coverage. Okay. And then you'll go ahead and see the updated 2026 formulary list. So, always download that, save it, but it does come in different languages for you too, if need be. And it is a big file too. So always hit Control F. And then I input the medication there. So just FYI, Control F is, a helper, so it makes it much quicker and easier. So we do offer prescription delivery through Express Scripts, pharmacy home delivery. Eligible members, they may save when ordering a 90-day supply of medicine. Members will get maintenance medication delivered safely on their schedule right to their door. So 2 easy ways they can get started. They can call their provider, ask them to send a 90-day prescription to Express Scripts Pharmacy, or they can go ahead to request prescription delivery in their online member account. Okay. Oh, I think I missed a page. Oh, broker portal. Okay. Sorry about that. So broker portal, for you all haven't logged in, take some time to log in, go to broker.ambetterhealth.com. If you have any issues, feel free to give broker support a call. That's 855-700-7985, option 2. So just a quick glance, real quick. I'm going to go through this quick, but the homepage, simply enjoy how your homepage look from active members, delinquents, and then those unpaid binders you'll see. Resources. So a lot of good information there. You'll find some training information, marketing materials. I always like to say if you are needing some Ambetter swag, if you got any events coming up, hey Shondell, I need some stuff. I got you. We got some pens, hand sanitizers. We got some fidget spinners and some other stuff. Feel free to reach out to me and let me know. I'll be happy to send those to you. Free of cost, of course. You're not paying anything. Yeah. So under the resource page, if you take some time, you'll see some stuff around the plans, forms, marketing materials again, social media, if you need some assistance with that, seeing what that looks like. And they all state specific too, FAQ. So any questions you may have, you might find it here in your portal. So once you go to the policy, I'm not gonna go too much, but it definitely gives you a whole breakdown, from active APTC. You can export it, if you need to as well. So, it just makes it much easier. But everything you should know about the member should be right there in your portal, right? You can go ahead and click on it. You can. Oops, let me go back here. I definitely did not want to do that, but yeah, quick glance. You can tell if your members on My Health page. They're on My Health page where they stand. You can order ID cards. You can make a payment, enroll in auto pay, if you need to, plan name, etc. Everything is there. I think one of the things that we have initiated and kept telling leadership, but change PCP. I always want to add that in your portal is the PCP change, but unfortunately that's not in the portal. But everything else is. So just want to make sure I point that out to everyone. So just some tips and reminders. So, we talk about the leverage your dashboard, the FAQs, those renewal letters, will be available in your broker portal during the OE. We're getting closer as we think. And then if you got any questions, broker sales support team, definitely give us a call. So the member portal and mobile app. So I definitely know if members haven't logged in, they can take advantage of that too. They come to you. I know a lot of come to brokers, asking questions and stuff, but they can go to member.ambetterhealth.com and also to take advantage of My Health page. Okay. Or they can download the Ambetter Health mobile app. I mean, everybody have a phone, everybody's in their phone. So why not download the app? Everything about your plan, billing, PCP, or if you want to make a change, you can do that. Even questions a member may have, just download the mobile app. And My Health page too, you can take advantage of that. Keep track of all that stuff in your phone rather than having to go to member portal. I know a lot of people not tech savvy or anything, but the phone is very easy, very easy. So, contact us. If you don't know how to reach your account executive, obviously I'm the account executive, so we won't have no problem with that. You can call broker support if need be. I'm here to help with education, marketing collateral, open enrollment planning, and a lot more, right? But if you need help with troubleshooting, commissions, password resets, and stuff like that, you can contact broker sales support. 855-700-7985, and you can hit option 2. But definitely just want to put that for a minute so you can see and who do I go to for what, but we pretty much do the same, but broker support is always a good helper, especially when it's memory related. Okay, so we're coming to the end, but what should you be doing? All right, we talked a lot today, and I want to wrap things up by talking a little about what you should be doing. So first, make a plan. This will not be a quote unquote normal open enrollment. Okay. Those of you who have done this for a long time might be thinking, has there ever been a normal open enrollment? And you're probably not wrong. It's always tough, right? But this year is going to be especially tough. And you need to be ready. Make sure you're using the broker portal to stay in the loop. Second, your clients are going to have questions. So make sure you're connecting with them early and often. Be prepared to help your clients if they get the DMI requests. Okay. Third, make sure all your clients have downloaded the Ambetter Health app. Take advantage of My Health page, but don't stop there. Make sure they log in, enable push notification as well. We included a QR code on the screen, okay, that will take you to the Ambetter Health app on the Apple and Google stores. And finally, communicate with us here at Ambetter Health. Do you have questions, comments, concerns, or feedback? We want to hear from you, and we value your insights and partnership. We want to make sure you're connected to me, as your Ambetter Health account executive. So, Other than that, I
Yeah.
appreciate everyone joining this program. I hope I didn't went, too overboard. I think I did. Sorry
Oh,
about that,
I
Jeff.
think we're good.
Yeah.
We still have several people on the call. We have a ton of people still on the call, so they hung in here till the end because we got more questions.
Oh, all
And
right.
this is more of a statement than a question. Lori asks, I desperately need Mason County in Kentucky. And, I think that would be wonderful if Ambetter could include that. And you know what? That's George Clooney's home county. I mean, why wouldn't
Oh.
Ambetter want to add Mason County, Kentucky? You know, come
Oh
on,
man, and
come on.
when we were looking to expand, and it really, I mean, the actuary, all them doing the stuff, it just they look at a lot of the market size, they look at networks being compatible, the plans, following the rules with CMS. It's a lot into
Yeah,
it. So
I understand.
but yeah, I mean, it's always good to get feedback and
Yeah,
have that on the leadership, like, hey, getting brokers asking we should expand here, but they definitely will look and see what opportunities are there. They always looking every year for
that's
sure.
Maysville, Kentucky for the
Yeah.
uninitiated, but
Okay.
home
Got it.
of George Clooney, Rosemary Clooney, you name it. So, another question: the new HSA eligibility on bronze and catastrophic plans look to be for those purchased through the marketplace only. So that's a nice. Thanks, Lael. Thanks for that tidbit. So the new HSA eligibility on bronze and catastrophic plans looks to be for those purchased through the on exchange marketplace only. Um,
Mm-hmm.
so that's from
Mm-hmm.
one big beautiful bill
Yeah.
from August. So that's law of the land. Next question. So did I see? Now I'm kind of moving on here. So sorry. So I did I see that right on the bronze plan for Kentucky? There's a $40 copay. I think you did. I think you saw that.
I can always go back if you need be, if you want me to.
I think you saw that.
Yeah, let me see Kentucky really fast. Sorry, I do have to go back like that to
Yeah. Thanks for hanging in
uh
there, folks.
yeah, yeah. This is Kentucky here, so
The bluegrass.
this is the everyday bronze in Kentucky.
Yeah.
Uh, that's one of them. And then there's the Focus Silver
Yeah.
in Kentucky. Yeah.
Yeah. Well, I saw a $40 copay on that
Mm-hmm.
everyday bronze. So, word of the wise, it's known as WellCare down in the Bluegrass State there. So, WellCare
Mm-hmm.
from Ambetter. So, you might see it out on the quoting engines as WellCare. So, what is the vision and dental benefit in Ohio? I know you alluded to that earlier. So, we want to go back to that.
Yeah, yeah, yeah. 1 second. Hey Jeff, give me 1 second. Your computer just froze. 1 minute. All right, Jeff, you're still there?
Yeah, I'm still here.
Okay, sorry about that.
We're all still
But
here.
yeah, I want to make sure I don't, get good off my computer too was dying too. But yeah,
Oh,
the vision and dental computer wasn't moving at all. Let me see. Okay, there we go. There we go.
yeah.
Yeah, so we got the vision, right? So no waiting period at all. This is just the vision. I'll go to the dental though, but the vision add-ons if a member want to take advantage. I will say too, these are in your portal as well, your broker portal. I know Ambetter don't, put it out there, and it's like, you all come like, hey, what does your vision and dental include, right? And we have to send it to you. But these are copies in your portal. If you go to under the resources tab. And then I think it's resources tab, and then it's marketing materials, I believe. But it's under resources tab for sure. But you can get a copy of the adult vision and the dental if need be. Just FYI for everyone.
Okay. Next question. Is the provider search tool how members visiting from out of state find a provider when they're vacationing?
Oh yeah, yeah, yeah. They can go to what was the find a provider.ambetterhelp.com. So they're out of state or anything. All they have to do is just, go on that site and they can look up in-network providers. They can also go through the member portal. We got the mobile Ambetter mobile app. So, I mean, they do have options. But for any reason they need to, search for any provider out of state or anywhere, they can just simply go to the find a provider and, see what's in network with Ambetter. Yeah, for sure. And
Right.
I'm always here if anybody has questions too around utilizing the provider tool. Right, in the past it was different, but they did some enhancement to it again to make it more user friendly for some. So but yeah, it should be more convenient for people just searching in network providers.
Great, great. So, what's your phone number and your email?
Yeah,
Did you
yeah.
put
Let
that
me.
up? Push
Sorry.
that up. That's all right.
Let's see if I was hoping I can type in the chat unless it's off. Oh, the chat is off. Or I can tell you, Jeff. Want me to tell you, or I was hoping I can type it in or
Maybe I
something.
can put it in the chat. How do you do that? So,
Yeah, it says
um,
it's the chat is turned off, but
okay. Huh, that's weird. I think I can start. Um, I can put it in the question box.
okay. Let me see the
Okay.
question.
What is your
Oh, you matter of fact, I can do it too, Jeff. It said ask a
yeah,
question, so where everybody
yeah,
see it. So yeah, let me
yeah.
what I'm gonna do, I'm put my my office number here for everyone. I'll give you my cell too, and also my email. So if you ever need to, reach out to me, I am here. Okay. So I have this give me 1 second and give you my office number here. Uh, and then give you my cell. So I just like to be accessible to everyone, right? You know what I mean? I just want to put a face behind it and say, hey, I'm here. Not every carrier has a account executive. They're here to help and support. 825 5834. Okay, perfect. So let's see, let me know if that came up, Jeff, on your end, like just as the question, or if everybody can see that. Um, but it should come up as my email, my office number, and then followed by my mobile, cell number if you need to reach me.
Okay. Well, I don't think it came over, but I do have a burning question here. We want clarification on the network for the dental and vision, not the benefits. So let's talk about the network. What is the name of the network for the dental and vision?
The network, even just like this year, it was under Centene. That was the name of the network, Centene. But what you want to start from is you want to start from the find a provider, the find a provider.ambetterhealth.com. And then, if you either looking for dental or vision, that's going to route you over to another site where you'll, be able to look up, in-network providers if you need to.
Okay. Rest assured, everybody, we will get you Shondel's email and phone number, whether it's today or in the follow-up. Now, another question that came in, will Ambetter cover Chicago St. Joe's this year? Well, in 2026. So Chicago St. Joe in 2026.
Chicago St. Joe's. No, no, not 2026. No, no word on that.
Okay.
Yeah.
No word on that. So, clarification on the bronze plan for Kentucky. Um, so is that $40 copay, is that available for telehealth as well on the bronze in
Um.
Kentucky?
Well, telehealth is offered, in Kentucky.
What?
Having going to $0 copay. Actually, they even take advantage of their service. They're actually in all of our states. Teledoc. So if a member want to take advantage of that's open to them. At a $0 copay, you don't have to worry about it. That's it. $40 copay was just on that Pacific plan. Obviously, but
Mhm.
Teledoc is in every state, especially Kentucky for sure.
And you said $0 copay on
Zero
Teledoc?
dollars. $0.
Yeah, and guys, a lot of carriers are adding co-pays to these teledoc because they're so popular. They all of a sudden start. So
Mhm.
that might be the best deal in town.
Oh wow.
Um,
Mhm.
I was asking about. Okay, that I could answer that. Any estimate of what we can expect as an increase for off exchange? I can
Oh,
answer
that's
that.
Rachel.
Yeah, I can answer that. It was posted in the federal guide sheet, and I think Ambetter, like some other carriers, it landed a little bit higher. You're between 25 and 30%, right?
Yeah, did you
Yeah.
see some recently, Jeff? No, on the
Well,
off exchange
it
piece?
yeah, on exchange. Oh, for off exchange? Oh, I see. For off
Yeah.
exchange, I'm sorry for the I was talking on exchange. I don't know what the expected increase would be for off exchange.
Yeah, I mean, if you imagine, Joe, I mean, I will say, and I connect with our ICRA team a lot, just on working those off exchange plans. I will say you're going to see quite some value in the off exchange compared to on exchange, especially in Indiana. I think what we were looking at was, I think it was 9%, 9 to 12% increase. From what I got, that we're
Okay.
looking on the off
90.
exchange.
Good.
Not bad though, right? But
No, that's
definitely
pretty
something.
much among the lower increases.
But
9 to
on
12%.
exchange, yeah, that's why I
Yeah.
tell people to rethink about it. Remember that's on exchange, off exchange is going to be quite some opportunity there. In off exchange with the even with the rate increases, we still should be pretty compatible and competitive too.
I appreciate everybody hanging in there. We're
Oh
about
yeah,
15 minutes past the hour.
so
Sean Dill
sorry.
he did include his phone and email in the question box, so you'll see it out there. More questions, more questions. Good, good, good. Um, so this is more of a comment. Indiana has a PPO, but Ohio and Kentucky do not. I think she's alluding to the off exchange.
Ohio and Kentucky. Yeah, not in Ohio and Kentucky. Yeah. In Indiana, yeah, Indiana, we got the Chris Bronson. Let me end this. Did I miss you, Joe? Still on? Okay.
I'm still here. Yeah.
Yeah. The Indiana looks like we got the PPO there, but yeah, no PPO in Ohio or Kentucky.
Yeah, and for the on exchange, do you have a PPO in Indiana?
Nope. Well,
Okay.
Indiana. Yeah, I mean Indiana. Double check. Was it Indiana? We still. Yeah, for the Premier. Yeah, there's no PPO. The only PPO we have is on the Solutions in Indiana.
All right.
So
Like I thought.
yeah, the
Well,
Solutions.
we're at time. We made it.
Man,
I appreciate everybody for joining us today. Everybody will get a copy of this presentation. We'll have to do some little editing, maybe shrink it down a little bit. We'll get it out. All the content will be there. And we're so delighted you guys could join us. Can't thank you enough, Shondell, for joining us. Any final comments?
hey, I just want to leave with this. Like I said before, it's going to be a rocky year, right? But Ambetter as a carer, I think year to year we have always just try to stay on top of things. I just stand in the state, county, not pulling out all that stuff. So I'm looking at, we're going to be at a good place. We're here to help you and support you. I'm here to help and support you. So if you have any questions or anything, I'm an open book. Feel free to call or email me. We wouldn't be where we are today if it wasn't for you. So I just can give all kudos and praise to you all. And as we get into open enrollment, we just try to keep our head up, with all the changes, government shutdown, all that stuff. So, but if anything come to mind, feel free to reach out, talk to me, let me know. Jeff is a great person I've been working with for the last years, and Cornerstone, so I appreciate them and what they do to support their brokers and their downline. So you're in good hands, just like Allstate, you're in good hands.
I love it. Well, we're not Allstate, please. Okay.
Right,
So,
no.
Cornerstone.
You're with Ambetter.
All right. Yeah. So, very good, everybody. I'll conclude the presentation. Have a great evening.
Thanks, Jeff. Thanks, everyone.